Stories from Real Life is a production of Media Well Done, LLC.
Today on Stories from Real Life with Melvin E. Edwards. What happens when medicine, artistry, and psychology intersect? This week, we sit down with facial plastic surgeon Dr. Michael Brandt to explore why facial plastic surgery is about much more than appearances. From reconstructive procedures that restore lives to subtle cosmetic enhancements that help patients regain confidence, Dr. Brandt discusses the responsibility physicians carry every time they change someone's face. Whether you're considering cosmetic treatment or simply interested in the psychology of confidence, this conversation offers a thoughtful look behind one of medicine's most fascinating specialties. This is Stories from Real Life, and today's story is Dr. Michael Brandt's The Future of Facial Plastic Surgery.
You are listening to Stories from Real Life, a podcast by engaging storytellers for engaged story listeners. Here's your host, author and journalist, Melvin E. Edwards.
Hello again, and welcome to another episode of Stories from Real Life. I'm your host, Melvin E. Edwards. Thank you for joining us for the podcast where real stories are so much more interesting than fiction. Today's guest has built an international reputation helping people look like the very best version of themselves. Dr. Michael Brandt is a certified facial, plastic, and reconstructive surgeon, internationally recognized educator, researcher, and assistant professor at the University of Toronto. His work combines medical precision with artistic vision, making him one of Canada's leading voices in facial aesthetics. He joins us from Toronto, Canada. Dr. Brandt, welcome to Stories from Real Life.
Thank you so much for having me on your show, Melvin.
Today, we're talking about confidence, aging, social media, ethics, innovation, and why the best cosmetic surgery often looks like nothing happened at all. So let's start with a couple of icebreaker questions. So some pretty simple things for you. So what's one misconception people have about facial plastic surgeons?
About surgeons in particular, that we're all members of, elite golf clubs and, that sort of thing. These days, we're just regular people. This is effectively a job. I get to do transformative things at work. But aside from that, it's a job. I go home, I've got my family, and at the end of the day, they're the most important thing in my world, and they're the reason I show up to work every day.
Nice. So is there a patient you'll never forget?
There are lots of patients we never forget. Through a whole variety of different reasons. If you do, one of my mentors used to say, if you do enough surgery, you're going to eventually have a complication. And the only way to avoid complications is not to do surgery. So, you always remember every complication. You remember every challenge you've had in the operating room. You remember all of those things, and they weigh on you a little bit. Conversely, you also remember the big successes, and you remember the opportunities you've had to impact on patients in very special ways. And we always carry those things with us.
Okay. So what if people only knew one thing about your profession, what should that be?
That's a great question. One thing about my profession. I guess I don't want to paint everybody with the same brush, but effectively, the one thing within our profession is that facial plastic surgeons have a unique set of skills. We understand sort of the head and neck region functionally. We treat a lot of problems, certainly throughout our training as head and neck surgeons. We do a lot of functional surgery within the head and neck space. And then we also do a lot of reconstruction and aesthetic surgery. So we're really able to combine the best of all of those worlds relative to function and aesthetics to really help people sort of restore themselves.
Okay. So those were just icebreaker questions and generally about your field. These questions will be specifically about you.
Sweet.
So what originally attracted you to facial plastic surgery?
So it's a good question. It depends on how long-winded you want me to get, but
you got as much time as you need.
There you go. So, I was first drawn to medicine for a whole host of reasons, and we can get into that. But within medicine itself, I always considered surgery to be what really was my calling. I loved the opportunity to do a physical intervention and effectively cure somebody with that physical intervention, and really be able to manipulate something, and in doing so, really restore their health, form, and function. And within that space, I was drawn to otolaryngology, head and neck surgery, where we really can impact on all the sort of functional organ systems of the head and neck. And then within that space, I happen to have a mentor who's a facial plastic surgeon. His name is Dr. Corey Moore in London, Ontario. And he took me under his wing, and I got to spend some time with him as a medical student. And, I saw the full breadth of facial plastic surgery, from helping people who are involved in, traumatic accidents to their face, curing skin cancers and reconstructing them within the head and neck, and then aesthetic facial surgery. And I love the combination of all of those aspects of my specialty.
All right, that sounds great. All right, so was there a defining moment when you knew this was your calling?
I don't know if it was a defining moment. It was just I could still think back to my time with Corey Moore, and that, I'd show up and I'd be excited about every single procedure we were doing. And there was really nothing else in medicine that really spoke to me in that same way, where, you show up and every day is sort of unique and interesting, and you have to employ creativity in everything you do, as opposed to some of the other procedures, which are very much, routine and pretty straightforward. And yes, there's variations in anatomy, but when you're, for example, you have a skin cancer on somebody's face, skin cancers never show up in exactly the same spot on everybody. Everybody's face is different. You're balancing a whole host of other factors, like, their age and wrinkles and all of these other features. And you're really trying to come up with a unique solution that's uniquely them, to really minimize the burden of both that cancer, cure that cancer, but also to minimize the burden of the scar and sort of the weight that they're going to have to bear far beyond the actual procedure.
All right, so has your philosophy evolved since you started being a plastic surgeon?
I guess it's always evolving. I think your judgment over time is really what gets better. So, throughout your training, you're learning judgment, you're learning surgical technical skills, and it's really a combination of the two. But as you get out into practice and you get more and more experience, you learn really who to operate on and who not to operate on a little bit more so. And that really refines things. And you really understand better sort of the risk reward ratio of doing things. And sometimes, you'll get a patient and I'll joke with them that, you're coming in as an 8 or 9 out of 10 and you want to get to be a 10 out of 10. And I don't know if we're going to be able to get you there. That sort of, trying to make a difference when you're already at that point is really, really challenging. Whereas, somebody who comes in and they have issues that would reflect more of a 6 out of 10 or a real sort of problem, getting them to that 8 is it's a lot better from both of our perspectives, from an expectation as well as a delivery to satisfy that expectation.
So who are the majority of your patients? Are they like skin cancer patients that you mentioned earlier, or are they older people or middle age who want to smooth out their skin back to a more youthful look?
So really, it's, the unique thing about my specialty and our clinic is I'm really able to interact with patients in a variety of different areas. So, my typical patient, I have younger patients who are coming in for prevention and they're looking for, perhaps Botox or neuromodulators or fillers or even laser resurfacing. I have male patients coming in for the same thing, and sometimes for hair restoration, hair transplantation. It tends to be more of a male dominated area. And then within the aesthetic space, like the aesthetic rejuvenation surgery type thing, it's a full spectrum of different individuals across the lifespan, both men and women. And, the common concept or idea is that, these are people who, are difficult or very much obsessed with themselves or whatever is just simply not true. We see a full spectrum of individuals across, the lifespan, across socioeconomic status, people from all walks of life who just want to look better, feel better about themselves.
All right. So are patients really seeking beauty or more confidence?
I think really they're really looking to be more confident. I think that is the biggest thing. We're really able to help restore their identity is really the goal there. As we sort of age or as things happen, you get a scar, you get something, you're almost losing a bit of your identity. You're losing your perception of self. And the goal of surgery is not necessarily to make you more beautiful per se. It is to try to match sort of how you feel internally with how you look on the outside so you could present your true identity and feel confident in yourself.
All right. So how much of your work is psychological?
I think all of it is psychological. I mean, I joke around and I talk about the fact that I do surgical psychiatry, right? In that I'm really able to use technical skills and a scalpel to make people feel better about themselves and, get back in the workforce, get back into meeting, somebody special and getting a relationship in their life when they've been self-conscious about some issue for a long time. The surgery itself doesn't restore that confidence. It is the psychological impact of that surgery. It's the burden that the person had coming in for that initial consultation and, overcoming that burden to talk about that issue and then do something actionable about that issue and really giving them some agency over that problem that now they've done something about it and now they just feel better about themselves.
All right. Has Hollywood TV shows and movies made your job harder or easier? And I'm thinking specifically about shows like Nip Tuck, which I've never seen before, but I know it's a plastic surgeon.
I think it's a mixed bag. So patients come in to some extent sometimes being far more informed if they watch some of these shows where it's certainly the reality shows where they really understand sort of what's involved and they've seen shows like Botched and things like that where they're seeing the bad side of aesthetics. Yes, sometimes people come in with unrealistic expectations and they come in and they show me a picture of a celebrity and they want to look like them and I'm like, well, you can't really do that. You look like you. So there is a bit of a challenge there, but to some extent, celebrity and social media celebrities and things like that do at least open up the conversation. So it makes something that used to be a bit more taboo, a bit more open, and people can talk a little more about it. And I think that is a positive component of it.
When people talk about seeing somebody and thinking they've had quote unquote some work done, what are they usually talking about? Is there a specific surgery they're talking about?
There's a variety of different things, right? Like, I mean, there was a trend where people had their lips done and they look ridiculous. And, I never really jumped on board to that trend, but I mean, that was blatantly obvious that you were getting stuff done and you wanted it to look obvious. In some parts of the world, having aesthetic surgery done that is more obvious is sort of a status symbol, maybe. But for most people, you don't want to look like that. You want to look like you want to restore that identity. But yeah, I mean, there are certain features of things, certainly in the non-surgical realm with filler and other stuff, that really do start to look bizarre. And you can really tell that people have just had too much and they haven't had somebody turn around and tell them, you know what, you've had enough. It's time to sort of cut back. And same idea with, the Michael Jackson effect, right? Like, somebody along the line should have said, you've had one too many nose surgeries, things like that. But unfortunately, sometimes the dollar drives the choice. And, sometimes the negative impact of not doing something, or at least the perceived negative impact of not doing something, is what really drives the bus. And it's unfortunate when that occurs.
What makes someone a good candidate for facial surgery?
So a good candidate for any intervention is somebody who is confident in who they are and themselves, right? They know who they are. They're not looking to be somebody else. They want to be themselves. They have a focused issue that bothers them, that they've identified. They don't come in and saying, just make me look better. No, they come in and saying, you know what really bothers me is this turkey neck. I've had this for the last 10 years. It drives me crazy. I want to look a little better. I want to go out. I want to be able to wear a buttoned up collar or something and not have it in the way. I just want to look rested and better from that perspective. And that's really what bugs me the most. And now we have a defined goal that we can work on together to improve it, as opposed to a nebulous sort of goal of beauty or something else that's very hard to achieve. It's really trying to match what we identify in our consultation as being a deliverable goal with a set of skills that we have as surgeons that we can deliver on that particular goal. And when there's a great match in both circumstances, then we get a great outcome for our patient.
If you're enjoying today's conversation, I'd like to invite you to visit MediaWellDoneLLC.com. That's where you'll find everything we do at Media Well Done, from this podcast to our growing library of books. You can also get a schedule of where our authors will be for their next book signing so that you can come out and meet us and get your book signed. Whether you're looking for a thought-provoking novel like Nuremberg, Mississippi, a family history like The Names They Kept, or the forthcoming historical piece Baker Battery Goes to War, you'll find them all in one place. The best part is that when you purchase directly from MediaWellDoneLLC.com, you're helping support independent publishing and this podcast, allowing us to continue bringing you meaningful conversations every week. Again, that's MediaWellDoneLLC.com. Check out the website for yourself and let us know what you think. You mentioned money being motivator a couple of moments ago.
Mm-hmm.
Obviously, if that's your only motivation, then you can do surgery on anybody for any reason. But where do you draw ethical boundaries?
Yeah. So, I mean, in general, it boils down to the ethics of the surgeon. You know, when I'm seeing patients, my job is not to spend their money. My job is to make a diagnosis first and still be a doctor, in the sense that I'm trying to sort out what the problem is, what they're coming in for, what is the defining feature that they're trying to make better. We're going to diagnose that. We're going to get to the bottom of it. We're going to figure out what anatomic area is really the part that needs to be improved upon. And then we're going to come up with a treatment strategy together that balances outcome and risk and everything else. And that's really what has to drive the consultation, what has to drive the plan and everything else, as opposed to, hey, I have this unique procedure that I want to offer everybody, and this is my hammer, and everybody that walks in is a nail, and we're just going to sell it to everyone.
How do you handle unrealistic expectations?
It's a challenge. I mean, some patients do come in and they're unrealistic, and we just have a frank conversation about it. And sometimes I'm not the right surgeon for them with that particular expectation. And we just advise them accordingly. I might not be the right person, or alternatively, this might not be the right time in your life to really be considering a major operation. People going through a breakup, for example, they lost their job and their expectations are that if I get this intervention, all of a sudden I'm going to be back on, the relationship market, or I'm going to be much more employable, and I'm never going to be able to deliver on those things. I have a very narrow set of skills relative to what I can do, and my impact, while it can make you feel better about yourself, and that can have ramifications, doesn't mean that I'm going to be able to deliver all those secondary gain type things that you're looking for.
Wow. All right. So has social media changed patients' expectations?
Yeah, absolutely. So, I mean, the challenge with social media is twofold. One part is sort of the snake oil salesman. It's sort of the new version of the snake oil salesman. We have something that cures everybody. You should come in, get this done. And they're preying on people who have sort of lost hope with a particular problem, and they're looking for some sort of outlet to make that better. So unfortunately, they fall prey to social media, where before and afters can be doctored. There's no sort of transparency, and there's no truth necessarily, required truth in advertising. And that's a really big problem. The other problem with social media is that patients come in thinking that they need a particular procedure. They've watched a procedure online, and they're sort of taking the leap and going forward from, instead of coming up with a diagnosis or coming up with a treatment plan, to I need X treatment because that's what I saw. And then they're coming in with that sort of expectation. Oh, I need this particular procedure. And then you have to spend time talking to them why they may or may not be suitable for that particular procedure, or they are a candidate, and then going forward from there. So it just requires a bit of re-education frequently with our patients when they.
What's the youngest patient you've had who came in for a plastic surgery consultation that wasn't medically necessary?
So we get younger patients sometimes for injectables, for example. So one area of expertise I have is in non-surgical rhinoplasty. So I use filler to add volume to people's noses to hide or distract features. So for example, if you happen to have a bump on your nose that you want to sort of make it go away, one option sometimes is to use filler, where we fill in the valley above and below, and sometimes that can smooth things out and can make it look really, really great as a temporary solution if you don't want to have surgery right now or there's some other concern. So I have done that on 16-year-olds as the youngest with their parental consent. And we have a long discussion for any young patient about the implications and risk and everything else. And they were in agreement and we fired ahead. I've had some young patients who I've had to do hair restoration on, who were losing their hair because they just have a genetic predisposition to early hereditary hair loss. And once we're able to stabilize them, they're not shedding, they're not losing anymore. They just want to sort of repair what's been lost. Then we can progress and we can sort of make a real impact on their life by restoring their hair and restoring their confidence.
Great. All right. You mentioned pioneering non-surgical rhinoplasty. I have two questions about that. First, why would they call it a rhinoplasty? That seems really cruel.
I know, right?
Second question, how did that evolve in your practice?
Sure. So I'm not a pioneer in this particular procedure. My practice is built on the shoulders of giants who've really done a lot of work in this field. I happen, to be colleagues with some of them, and they're amazing individuals who've really trailblazed in this area. As far as rhinoplasty, I guess that's Latin, and I can't speak to why that's what it's called. But as far as the procedure itself, liquid rhinoplasty or non-surgical rhinoplasty, that's evolved in my practice to fill a gap. It's really for the patient who want a minor intervention that takes about 15 minutes that can really dramatically change the profile view of their nose, make them look a whole lot more rested and confident without having to undergo the knife and go through sort of a big surgery, big recovery, all of those factors. The other part to it is that it allows me to do minor nuanced improvements when you've had a previous rhinoplasty. So sometimes when you've had a rhinoplasty, you're not 100% satisfied with, very minor things that can sometimes be tweaked in a non-surgical way to make them look that much better.
So how has changing technology changed your practice?
So changing technology always keeps us on our toes. We're always looking for the best possible outcome for our patients. So we're always looking at what the newest technology is and how it can help us facilitate that outcome for our patients. So I'll use hair restoration as an example. Hair restoration has evolved dramatically over time. It used to look like these weird doll hair plugs that were done, back in the 70s and 80s. And these days, it looks amazing. You can't tell that people have had it done. And part of that technology that we've employed in our practice is the use of a robot. So we have an Artist IXI robot that helps us harvest the grafts. One of the challenges of hair restoration, especially the technique we do, which is follicular unit extraction, is you have to systematically go one by one harvesting follicles. And you could be harvesting 2,000 plus follicles in an individual day. And the technician doing that is bringing their baggage into that procedure that morning. The kids woke up early, they didn't have a coffee, there's some issue there, and the quality of the first graft that's been harvested may not be as good as the quality of the 2,000th graft that's been harvested. So sometimes employing a robot who has no baggage and doesn't care and looks at each individual follicle 60 times per second, it can ensure that we are getting the best quality follicles throughout that harvest so that we can get the best possible outcome for our patients at the end. So it's really about evaluating the technology, seeing how it fits into our practice. We're not super early adopters of every little thing on the market. We want to make sure that things have been tried, tested, and true before we bring it into our practice. But once that's established and we think we can bring something in that can really serve our patients through lower risk, better outcomes, then we'll certainly bring it in.
You've probably seen some of these memes online where people are comparing a 45-year-old, let's say in 1970, to a 45-year-old today, and how
Right.
the standards are clearly different. So why are people approaching aging differently today?
I don't know. I think, part of that's ageism a little bit maybe, but I think people are, they're just looking at things differently. And I'm not super hip to sort of the aging or anti-aging per se trend. I think it's about living your best life, and we don't have to erase every single wrinkle on somebody's face. I mean, some of those wrinkles have been a product of, their entire life, their battle scars, their what sort of got them to today. And most of my patients who come in don't want that. They don't want to, I don't want to be 20 years younger. I like where I am in my life. I like everything that's gone into this face. I just want to feel a little bit better. I want to look a little better. I want a little less hangy skin here, a little less hangy skin here, a little bit less jowl. I want to feel like my identity is really reflected in my appearance. And that's really who we cater to at our.
Yeah, it seems like it comes down to acceptance. Like for me personally, I turned 60. I will be turning 60 this month, and I've been going through a lot of pictures because this is a milestone birthday, and thinking, well, 10 years ago I looked different. 15 years ago I looked very different. But I'm satisfied with how I look. The lines I've got on my face I feel were well earned. I've got stories to tell about each one. So I'm not interested in plastic surgery. I realize it would help me look better, but that's not my goal. And I'm sure other people have different objectives.
For sure. Yeah, everybody's goal is different, and the objective isn't necessarily for you to look better for somebody else. The objective there is for you to look better when you look in the mirror. And when you're looking at yourself and you're more confident in how you feel and how you appear, and you're reflecting that true identity, then that's really a success on our part. And if you feel that way already, then you're not a candidate for surgery. You really don't need to do anything. And we tell patients that all the time. You really don't need to do anything. But for some people, we're here and we're able to really make an impact on their.
All right. So what's the biggest myth about aging?
The biggest myth, I don't know. I'm not sure about the biggest myth. I guess from my older patients, it would probably be that they're the golden years. I mean, a lot of them complain about the fact that as they get older, they spend more time seeing doctors and people like me than anybody else. And they just want to be able to get back and enjoy their life. And sort of, vitality is lost on the young, in that, you getting up out of bed and being mobile and functional and all of those things are taken for granted in our youth. And I think being aware of that, being aware of the fragility of life, and the ability to try to maintain an active existence into your older years is really the most important thing, so that you can enjoy that time and you can get out of bed relatively pain-free, and you can interact with your family and all your loved ones.
All right. So is there an artistic side to what you do?
Without question, absolutely. As I said earlier, there's a creative aspect to everything we do. While there are components of different surgeries that are technical and routine per se, there's always a bit of creativity. Like, where do we put the scar? How are we going to fix this particular skin cancer? How are we going to reconstruct it? All of those factors come into play. And that's the part of this specialty that I love the most, is that ability to be a bit creative with what I do and try to come up with a unique solution to an individual's problem.
You mentioned robots earlier.
Mm-hmm.
How about AI? How has that changed cosmetic medicine?
So, a robot does use AI to some extent to help identify sort of best quality follicles, and AI is evolving. It's doing some amazing things. We're able to make diagnoses that we couldn't before. We're able to integrate things that, in a standard individual are really difficult to integrate in your brain. As far as looking at somebody's appearance and integrating different components into a comprehensive plan, or looking at all of these different metrics within their health and their longevity, and trying to come up with the best solution to their longevity. So AI is really impacting on those things. Luckily, AI hasn't gotten to the point yet where it can do successful surgery. So I'm not out of a job quite yet. But it is really helping on the diagnostic component, the integration component, the imaging components of healthcare. It's allowing us to integrate and have more information so we can really come up with the best treatment plans for our patients.
All right, that sounds great. All right, so let's talk about entrepreneurship. So you built something called Form, FORM, and it obviously requires more than surgical skills. What have you learned about leadership through that formation?
Yeah, that's a great question. So yeah, I'm one of the main partners here at Form, Face, and Body. I've got some other great colleagues and partners. One of my partners is the CEO and full founder of Form. He, Dr. Samoji, and really as far as leadership goes, really, I think the most successful leaders are listeners. Being able to listen to those around you, creating a culture around us that drives people to feel that they can contribute to the greater good than anything else. And culture is really the most important thing about our practice. Everybody here is open to making their suggestions. We take everybody's suggestions seriously, and it allows us to provide the best possible care to our patients.
All right. So how do you create an exceptional patient experience?
So part of it is that culture. It's identifying sort of what happens when you pick up the phone and call us, and listening to that and talking with our team members about sort of that experience. And then each individual touch point throughout the day when somebody comes into our clinic is sort of curated and it's worked on, and we're continuously refining it, trying to make it better and better and better for each individual patient. Your whole pathway, once you've had surgery, all your touch points afterwards, who you can reach out to, everything. That entire complex part of your interaction with our clinic is really something that we feel is important, and something that we try to make the best for every individual patient. And as I said before, we're really trying to constantly refine that to get it better and better and better.
All right. In the intro, I mentioned that you were an assistant professor at the University of Toronto, and you trained some physicians from around the world. Mm-hmm. What separates great surgeons from just merely competent ones?
I think it goes back to judgment and integrity. I think those are the two things. So, ensuring that you are taking care of people for the right reasons. At the end of the day, we're in the profession of taking care of people. We're not robots. We're not mechanics. We're taking care of people, and being able to really take care of them like family is the most critical. Having the integrity to accept, failures and improve on things, accept problems when they come up, and take care of people through those problems, and not simply dismiss them and send them on their way and it's somebody else's issue. We really want to ensure that once you've come into our clinic, or once you're interacting with myself, that we're going to care for you no matter what happens. You are our patient, you're a member of our Form family, and you're going to get that best treatment because of that.
All right. So first day of class in one of your courses, what's something you tell your students that you want them all to remember?
Yeah, I think, part of that is beyond surgery. I think the most important thing that I tend to tell students who visit or come hang out with me or whatever is, at the end of the day, this is a job. And while it's a fulfilling job, it's an amazing job, and we've got all sorts of opportunities to interact and improve people's lives, it's still a job. And, at the end of the day, one day you will retire and people will likely forget that you existed, except for the people that are most important to you, your family, your children, all of these people. And really, that is why you're here. That is who's most important in your world. And you really have to remember that and keep that in mind, because there's a lot of opportunities in healthcare to allow academia and the pursuit of, all of these accolades to really take a priority. And at the end of the day, you want your family to be the number one priority in what you're doing.
That sounds awesome. So as we start to wind down the conversation, I've got a few rapid fire questions here for you.
Sure.
So we'll just go through these quickly. So the most overrated beauty trend?
Threads, surgical threads. So people using these barbed sutures and other things to try and lift people's faces and, shortchange major surgery. I've never seen a long-term result for anybody who's ever had a thread procedure. All I've seen is problems with that individual procedure. And it's one of these things where the cart is leading the horse, the technology exists, and people just trying to sell a procedure simply because it exists on the market, but it doesn't work. And I hate people who are taking advantage of it.
What's the most underrated skincare habit?
Sunscreen. Honestly, that is the best possible. It doesn't matter if you have skin of color, doesn't matter who you are. If you use sunscreen on the regular, you will wrinkle far less than anybody else you know. So just using the sun, taking care in the sun is really going to pay huge dividends in your long-term skin.
All right. Personal question, coffee or tea?
It's got to be coffee all day long.
What kind of coffee?
Usually morning is black, and then throughout the day, just a bit of milk.
Okay. Morning or night?
For the coffee?
For you.
In general, am I a morning person or a night person? I'm a bit of both. I'm one of these people who luckily doesn't require a lot of sleep to function. It helped me out throughout my training, so I'm quite happy with both. If I have the opportunity, I'd rather sleep in if I can.
All right. One book everyone should read.
It's a book that I read not too long ago. It's critical reading for anybody that asks me. It's a book called Hostage by Ali Sharabi. It describes his experience and his vitality and his ability to survive in awful circumstances. He was taken hostage as part of the October 7 attack on Israel, and he writes a full comprehensive story of what occurred to him as a hostage. And it's an incredible story, unfortunate, but incredible.
What's your favorite city?
My favorite city, I have so many. In the US, I would have to say Chicago. I love Chicago as a city. New York's great as well. Big fans of both of those, but I haven't seen everything, but I love those. If I had to pick one, San Diego, which is an awesome city. Just love the weather there. As far as my favorite city to visit in the world, I would have to say Tel Aviv.
Tel Aviv? Is that?
Mm-hmm.
Okay, cool.
Yeah, it's
what's
a
one
multicultural. It's just sort of a multicultural sort of place where people just sort of really enjoy life. It's an amazing, very vital city that you really have to experience.
All right, that sounds great. All right, what's one thing people should stop worrying about?
Stop worrying about how other people perceive them. I mean, is really the main thing, right? Like, we're all self-conscious individuals, but to some extent, as we age and as we get a little older, we stop caring a little bit about that, and we start caring more about our interactions with other people and relationships. And I think that's much more important to care about than your self-perception and just being self-conscious. And you don't want your self-consciousness to restrict you from participating in life. You want to be able to get out there and do things. And that's part of what drives me in my specialty, is that in some individuals, that is having a big impact on their ability to participate in life. And we can make an intervention to make that.
Last question of the day. What's the best career advice you've ever received?
Treat patients like family is the number one advice. Take care of people the way you would want to be treated is really the most important thing. And I can't think of anything else. I think that's the most critical.
Great. That's a great way to wind up this episode. So my guest today has been facial plastic surgeon Dr. Michael Brandt, who has explained how medicine, artistry, and psychology combine to restore confidence, redefine beauty, and change lives. You can find links for Dr. Brandt and his works in the show notes on your favorite podcast platform. Dr. Brandt, thank you for being here today. I really appreciate it.
Thanks so much for having me on your show.
Thank you. So that's it for this week's episode of Stories from Real Life. Until next time, don't forget to shine your light wherever you go.
That was Stories from Real Life. Join us again next week for another great storytelling journey. See you next time.
Stories from Real Life is a production of Media Well Done, LLC.